Good afternoon, everyone. How are you today? Welcome to Sunday. I'm looking forward to chatting with you this afternoon. As promised, we're going to be talking about intrauterine devices today. We call them for short IUDs. And so I'm going to give you guys just a couple of minutes because I think we have some exciting things to talk about as they relate to IUDs. So thank you for joining. Hey, how are you? Great, thank you for joining. Okay, so intrauterine devices, what are they? They are actually a very, very effective form of birth control. They are more than 99% effective, and so for that reason, they are very commonly used by some women who want to have something reliable as they consider their birth control options. One of the things that people really like about IUDs is that they can be in place for a long time. So, consider things that you would compare them against. So if you're talking about like birth control pills, you have to remember to take those every day. If you're thinking about the shot, the Depo-Provera shot, you have to remember to go back and get that every 3 months. But IUDs, when some women think about IUDs, they think, oh, okay, that's pretty good. I can have that in place and be good for as low as 3 years to as far out as 12 years. And today we're going to talk about some of the different types of IUDs or intrauterine devices. But first, I thought we would start by really talking about some of the myths, because one of the reasons why IUDs, intrauterine devices, are not used more commonly by women is because they've had a long history and some bad outcomes that went along with older versions of IUDs. So these days, the IUDs on the market are newer. They are definitely effective. And so I want to spend some time clearing that up. So the first myth I want to talk about is one of the ones that's very common, and that is IUDs cause infection. So back in the 1970s, there was a very popular form of IUD out that was called a Dalcon shield. And that Dalcon shield was, a little serrated type of device. IUDs, I'm going to show you a picture later, are very small. They fit into the uterus. But the other problem with the Dalcon shield is that the string that attached the IUD and helped it to stay inside your uterus that could easily be grabbed when it was time to come out, that string was made of a particular type of material that bacteria really liked. So bacteria from the vagina would get onto that string and go up into the uterus. And so absolutely it is true that in the 1970s, the Dalcon Shield IUD was associated with more infections. And so the good news is that IUD was removed from the market some years ago. So it's no longer on the market or available for women to use. The IUDs that are out now are IUDs that were made in the mostly in the 90s and that have been tried and true, shown to be very safe. And so those are the IUDs I'm going to spend some time talking with you about today. The second myth that I want to cover today is one that used to be discussed a lot from among different women as they considered their options, and that is the myth that an IUD cannot be used in teenagers or in women who have never had children. And the thought used to be that if the uterus had never been... Hi, Dr. Banga, thank you for joining. How are you? Let me see. Okay, I'm trying to learn by responding to the different things that are in the box. So thank you for joining, Dr. Banga. And so, it is not the case that IUDs cannot be used in teens or women who have not previously had a child. And so as the newer IUDs came on market and studies began to look at what was the long-term impact and reviewing the cases of women who had had these newer IUDs, we really learned a lot very quickly, I would say, in the last 20 years. And so, again, an important myth that's not true anymore is that IUDs cause infection. And another myth that is not true is that they cannot be used in teens or women who have never had a child. A third myth that I want to cover is that one women believe is that if you have an IUD and you decide to take it out, that you will not be able to get pregnant ever again. That's absolutely not true. An IUD, when you remove it, when it's one of the newer IUDs, and again, we're going to talk about those, you can remove them without any difficulty in the window that they were due to be in. So there's one IUD called a Skyla. You can leave that in for 3 years, and when you remove it, if everything else is within normal range, your fertility should return right away. And then there are other IUDs that have different lengths of time that you can have them in, and we'll spend some time talking about those as well. But again, I wanted to start by clearing up those myths, because I promise you IUDs are very safe and long-acting forms of birth control, and they're forms of birth control that I talk with my patients about all the time. More and more women are asking questions about these long-acting reversible contraceptives because they allow them to do things more freely. Having something that's long acting means you don't have to think about taking a pill every day. You don't have to think about the shot every 3 months, and it just gives people more flexibility. If they have the vaginal ring, they don't have to think about trying to remember, has it been in 2 weeks, has it been in 3 weeks, when do I take it out? And so for that reason, a lot of women like IUD. So IUDs come in 2 big categories. One category is an IUD with no hormones, and there's one particular one on the market right now. It's called a Paragard, and that one can be in place for as long as 10 to 12 years. And the other group of IUDs are IUDs that have hormones in them, and those can be in place for a range of years. And so let's start by talking about the Paragard. And I always like to try to show a picture. I'm a visual learner, so for those visual learners out there, let me show you this little picture. So if you can see, I like this one because what it's trying to show you is that compared to the size of a hand, these are the sizes of the IUD. So you can see how small they are. This one here kind of demonstrates the copper one. You can see that if you were to see it in real life, it has little copper coils that are around it. It's shaped like a T. Both forms of IUDs are shaped like T's. It has a little piece of copper around it, and that copper works as the method by which pregnancy is prevented. Sperm doesn't like copper, and so if a woman has a Paragard IUD in place, anytime some sperm come through the vagina up through the cervix and try to get to the place where they can meet an egg in the fallopian tube, that copper on that IUD says, no, 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 wait a minute, we're here so that you can't get past and get to where you want to go. So that copper IUD is very effective. Again, over 99.9% effective. Another thing that people may not know about the copper IUD or the Paragard is it's also a form of emergency contraception. So if a patient comes in, if you were having sexual intercourse and the condom broke or something like that, if you come in within 5 days and an IUD is inserted into your uterus, that Paragard has over a 99.9% chance of being effective in preventing you from getting pregnant. So that's a very effective form of... Hi, Janet. Thank you for joining. Thank you so much. So that Paragard IUD is very effective also when used as an emergency contraceptive. So I always sing praises of the Paragard IUD. I had one after my 3rd son, and I took advantage of all 12 years with that Paragard IUD. So again, it's a very effective method for women who are looking for something long term. So the other group of IUDs that I want to talk about are hormonal IUDs. Oh, and let me also say this also before I leave the Paragard. Paragard, because it has no hormones, is definitely the one we choose when a woman has other medical conditions. So if she has high blood pressure, if she has anything that having hormones in her system is not going to be good, the Paragard is what we recommend for her because it has no hormones and it's a safer option for her. The second group of hormones, as you can see here, again, same size, they're small, they fit in the palm of your hand, but these hormonal IUDs have a different type of progesterone, a progestin built into the IUD, and that progesterone hormone basically helps prevent pregnancy, and it does that in 2 ways. It does that first by causing the mucus that's at the cervix to be a little bit thicker. And that mucus, when it's thicker, it blocks the sperm from going up into the cervix to try to get to the egg, which is going to be released from the ovary and go down the fallopian tube. The other way that it prevents pregnancy is that it stops eggs from being basically released from the ovaries. And so by those two mechanisms, they work very well. Now, there are several types of hormonal IUDs for you to be aware of. And when I'm seeing patients, really the counseling is about one, what type of, if they're interested in contraception, are they interested in something that's long acting and reversible, or do they want something permanent? That'll be something we cover on another day. Permanent contraception is usually, women who might want to get their tubes tied or something like that. So one, if they want reversible contraception in the form of an IUD, what amount of time do they want? Some women want 3 years before they want to try another pregnancy. Some women want 12 years because they want to try to close that window and not have to worry about still being fertile when they remove their birth control option. And so when it comes to the IUDs that contain progestin, there are 4 currently on the market. All of them are very safe. Again, we're talking about IUDs that have been proven safe during the 90s and 2000s. We're no longer talking about that Dalcon Shield that was popular in the 1970s, but that had a lot of problems with it. So the 4 that are on the market right now that are FDA approved are the Mirena IUD. That one can be in place for as long as 7 years. The Kylena IUD, that one can be in place for as long as 5 years. The Liletta IUD, that can be in place for as long as 7 years. And the Skyla IUD, the one that I mentioned earlier, that can be in place for the shortest amount of time, and that's 3 years. The beautiful thing about all of these types of IUDs is that they are inserted very easily in the office setting. So it usually happens if a patient comes in and an IUD is the method that she's choosing. And, definitely take the time when you're talking with your provider, talk with them about all the different options that are available. We have a range of things that are available to us in terms of birth control right now on the market. And so whenever I'm talking with a patient, I try to make sure that I give her all the different options available so that she can make an educated choice, and the provider is there to help answer the questions and make sure you get the thing that is going to work best for you. And so IUDs, if that's something that the patient has chosen, we go through the informed consent process. We talk about the risks and benefits and alternatives if she's not quite sure that that's what she wants. But once she has decided that an IUD is her method of choice, then that process takes less than 10 minutes in an office visit. And so how you go in and you have your pap test, and your feet are in the footrest and the speculum is in and the pap test is done, and maybe that takes a minute or two. So if someone wants an IUD, I would say add about 3 to 5 more minutes to that process. The area where what we call the cervix, the mouth of the womb, we clean it with something called like a betadine. We hold the mouth of the cervix. Sometimes there's some cramping with that, and we always make sure we offer women, if they tend to cramp during their cycle, we offer them the opportunity to take ibuprofen or Motrin before the procedure, or a lot of times offices will have it there to give to you. And then when the device is actually inserted into the uterus, that process also causes some cramping as well. And so altogether, though, when I've put this in patients, and I can also tell you from personal experience, when I had it placed myself, the cramping that I had maybe lasted about, I would say, 2 to 3 minutes. And then it's done. And you have a protection against an unplanned or undesired pregnancy for as little as 3 years to as far as 12 years. And so so those are the different types of IUDs that I wanted to tell you about today. And also and speaking about the different myths that are out there, really trying to encourage conversation more about IUDs as a really effective type of birth control, and just making sure that you guys are as informed as possible so that you're aware of this really effective method that I think more and more women are taking advantage of, but it's probably something that more might be interested in if they knew that we were no longer talking about the Dalcon Shield, if they knew that we're no longer talking about devices that can be inside your uterus and cause long-term infection or cause you to have your uterus out. These are all things that I've commonly heard from patients when they were expressing concerns about trying something like the IUD because they have heard those stories. So the good news is the Dalcon Shield is off the market, and the IUDs that we currently use with patients are very, very safe. I encourage you to go beyond this listening session here, and if you have additional questions, by all means, send me questions through the messenger, through Dr. Madeline, MD. And also, if you have an appointment scheduled with your provider, be sure to ask them about it. I find that my patients who are at different phases of life like IUDs. So it can be my student who's about to start undergrad and she wants to get a solid 4 years in. It can be my mom who is after her second or third child and she wants to have something in place for longer term because she is not certain that she wants to have any more children. An IUD can be a great option for a range of women. And so that's what I wanted to share with you guys today about IUDs. I again encourage you, if you have any other questions, feel free to inbox me. Also, you can Google some of this information. Again, the names of these IUDs are Paragard, Mirena, Liletta, Skyla. Those are the most popular ones that I tend to use in my office. So again, I want to thank you for joining or for watching if you tend to watch the replay later. And I appreciate you guys. And if you have any questions or feedback, feel free, please, to look me up on social media. I'm Dr. Madeline, MD, and that's DrMadeline, MD. Thank you so much for joining today. Thank you, Dr. Banga. Thank you, Janet.